If you are listening to this informational video, it's because you or a loved one is taking a new medication called warfarin, or also best known as Coumadin. Coumadin is an anticoagulant that helps prevent blood clots from forming. People often speak of Coumadin as a blood thinner. Although it's a widespread common name, it can sometimes bring to confusion. Coumadin does not actually thin the blood. It is used to help prevent the clots from becoming larger. Your current medical condition puts you at a higher risk of having blood clots. These clots can enter the bloodstream and block major blood vessels, especially in the brain, the lungs, and the legs. This can therefore prevent adequate blood flow and cause problems such as CVA, cerebrovascular accident, also known as a stroke, pulmonary embolism, or phlebitis. Coumadin prevents a new clot from forming or an existing clot from growing. There are several medical conditions that can cause the forming of blood clots and require the use of an anticoagulant. The most common reasons for taking Coumadin are atrial fibrillation, thromboembolism, such as phlebitis, pulmonary embolism, and heart valve replacement. If you're not sure why you're taking Coumadin, ask your doctor. We will take a brief look at Coumadin's clinical utility. Your understanding of this information will help make your anticoagulant therapy as successful as possible. For those who suffer from atrial fibrillation, a type of arrhythmia, or have suffered a stroke or heart valve replacement, there is a risk of thrombosis, which is the forming of a blood clot inside a blood vessel or in the cavities of the heart. The clot can form in the heart itself, break away, and lodge in a coronary artery. Coumadin is then used on people in order to prevent this kind of complication. In people who have suffered a pulmonary embolism or phlebitis, we use Coumadin to prevent the clot from growing in the lung or leg area. We then continue with Coumadin for a few months to prevent a recurrence of clots. The duration of Coumadin treatment, depending on your medical condition, can somewhat vary. Some people require Coumadin for a period of 3 months, while others require a long-term treatment or may even require Coumadin as a lifetime commitment. To know more about the duration of your treatment, ask your doctor. Unlike other prescription drugs, Coumadin may vary from one person to the next. To determine the right dosage of amount of Coumadin, blood tests are necessary. We will then measure your INR, International Normalized Ratio. The International Normalized Ratio is used to determine the effects of oral anticoagulants on the clotting system. Depending on your medical condition, a safe and efficient INR target range will be established. The therapeutic range for INR is typically 2 to 3, or between 2.5 and 3.5. The INR is the ratio between the time it takes normal blood to clot and Coumadin blood to clot. The higher the INR, the longer it takes the blood to clot. A healthy person not on Coumadin will have an INR of around 1. For example, if you have an INR of 3, it means that your blood takes 3 times longer to clot than that of a person not taking Coumadin. If your INR is below the target range, it means you are under anticoagulated. On the contrary, if your INR rises above the high end of your range, your risk of bleeding and bleeding-related events may start to increase. Your goal is therefore to be in the normal INR range assigned to you in order for it to be effective, all the while being safe. To achieve this range, many health professionals will help you. Your INR results will be used to adjust your Coumadin dose. Ask your doctor about the INR region assigned to you and take note of it in order to follow the evolution of your treatment. Each Coumadin tablets each have distinctive color that indicates its strength or how many milligrams are in them. If necessary, all these pills may easily be cut in half. Once discharged from the hospital, you will be given 2 different prescription strength tablets in order to determine the right dosage and avoid returning to the pharmacy. Coumadin should be taken at the same time each day, once a day, preferably in late afternoon between dinner and bedtime. It is not necessary to take Coumadin with food. It is possible that during your treatment, your Coumadin dosage may change. Make sure to follow the most recent guidelines given to you. If you forget a dose, do not take a double dose the next day. In concrete terms, if you realize on the same day that you forgot a dose, you can take it without any problem. Otherwise, omit that dose. Notify healthcare professionals who provide your follow-ups of any missed dosage or taken twice as you notice the error. It should be noted that Coumadin takes at least 2 days before it begins to work, and 4 to 5 days before it reaches its maximum effectiveness. As previously discussed, the goal of Coumadin therapy is to decrease the tendency of blood clotting, but it does not prevent clotting completely. Therefore, the degree of blood coagulation requires close monitoring to ensure that the INR target range indicates that Coumadin is efficient and safe. In order to do so, blood tests must be done regularly. In the beginning of your treatment, blood tests will be more frequent in order to determine the appropriate dose of Coumadin for you. Little by little, as your INR progressively stabilizes, the frequency of your blood tests will decrease. In the beginning of the treatment, we generally start with 1 to 2 blood tests per week. Then, the interval gradually increases between blood tests up to a minimum of 1 blood test per month. Your Coumadin follow-up treatment can be either done by your attending physician or an anticoagulation clinic. A Coumadin clinic is a group of highly trained nurses, pharmacists, and doctors who specialize in Coumadin monitoring. If you do not know who will monitor your treatment, ask your nurse or doctor before being discharged from the hospital. Regardless of who will do your follow-up, procedures are generally quite similar. Before being discharged from the hospital, determine with your nurse where you want to take your blood tests, depending on resources near you, such as a CLSC, hospital, blood clinic. Blood tests are usually done in the morning, and there is no need to fast before the test. Upon discharge from the hospital, we will let you know the date of your next blood tests and the Coumadin dosage that you must take until your next follow-up appointment. You will then be taken care of by your attending physician or by a Coumadin clinic. Your first blood test result will automatically be sent to the health professionals who provide your follow-ups. They will then contact you to inform you of your INR results, to schedule your next blood test appointment, and to inform you of the dose of Coumadin you must take. Doses of Coumadin may vary from day to day. It is important to write down the dose of Coumadin that will be indicated to you for upcoming days on a calendar. Always have a calendar on hand or near the telephone, so you'll be ready when we call. Depending on the stability of your INR level, your next blood test will be scheduled according to your availability. In summary, each time you have a blood test, we will call you to inform you of your latest INR result, set a date for your next blood test, and inform you of the recommended dose of Coumadin to take until your next blood test. Coumadin has a large number of interactions with other drugs, vitamin K and alcohol. They occur for a variety of reasons. We will therefore take a detailed look at each of them and their effect on Coumadin. Many drugs can interact with Coumadin and increase your risk of bleeding or decrease its therapeutic effect. It is therefore very important to seek advice from your doctor or pharmacist if you want to start or cease taking a medication, even if it is homeopathic health products, specialties, vitamins, food supplements, and over-the-counter products such as pain relievers or cough medicine. If you are taking a new medication or have adjusted any, or you have ceased to take a medication, it is important to inform the health professionals who monitor your follow-up, because this could have a significant impact on your INR results and the necessary dose of Coumadin. You should in particular avoid taking ibuprofen such as Motrin, Advil, or aspirin, unless your doctor has prescribed low doses of aspirin, such as 1 tablet once a day. These may increase your risk of bleeding. If you need fever reducers or pain relievers, it is best to use acetaminophen. It is safer to use with Coumadin. But if you take acetaminophen more than once a day and for longer than a week, you should notify the health professionals monitoring your Coumadin because of the effect it can have on your INR. Alcohol can also interact with Coumadin. Moderation is the key element. That is, a maximum of 1 to 2 alcohol drinks per day. Avoid excessive alcohol consumption, as it may increase your INR results and the risk of bleeding. In addition to being a stomach irritation, alcohol predisposes of gastrointestinal bleeding. Another aspect to take into consideration is the use of vitamin K. Vitamin K and Coumadin work against each other. It consists of a vitamin which promotes blood clotting and decreases INR results. Vitamin K is mainly found in green vegetables. Despite its opposite effect on Coumadin, it is not forbidden to eat foods containing vitamin K. As previously mentioned, your Coumadin dose will be adjusted according to your INR results. If you regularly eat foods rich in vitamin K, your Coumadin dose will be adjusted to suit your needs. The importance is consistency and regularity of vitamin K consumption. If you decide to radically change your diet and vitamin K intake, your Coumadin dosage can also change. It will be difficult to find the right dose of Coumadin. On the other hand, if you eat a relatively similar amount of vitamin K each week, be it a small amount or a large quantity, it will be easier to maintain a stable INR and dosage. You will simply receive a lower or higher dosage depending on your vitamin K intake. In short, it's the INR that counts, not the dose of Coumadin you are taking. The key to success is regularity and food reliability. Remind yourself that vegetable consumption is not forbidden when taking Coumadin. Your health status can also have a direct effect on the stability of your INR level. It is therefore important to notify your Coumadin clinic or your physician if you have the flu, cold, loss of appetite with fever, vomiting, or diarrhea for more than 1 to 2 days. Since Coumadin prevents blood clots from forming, it may cause unintended bleeding. When the INR is at its target range, the risk of bleeding is relatively low, and the bleeding is rare. However, as blood takes longer to coagulate, it's possible that you may bleed easier than you usually do. This is normal. You must therefore avoid activities that increase your risk of bleeding. Among other things, you should avoid contact sports and, if possible, wear gloves when handling sharp objects. When shaving, use an electric razor rather than a razor blade. During oral hygiene, use a brush with soft bristles, and be careful while flossing because gums tend to bleed easily. If bleeding occurs, simply apply a pressure for a few minutes until the bleeding stops. When the INR increases above its target range, there is excessive anticoagulation, and the risk of bleeding increases. It's important to notify your doctor or your Coumadin clinic of any injuries, falls, loss of abnormal bleeding. Abnormal bleeding means persistent or heavy bleeding. Presence of blood in your saliva, sputum, vomit, stools, or urine excessive nosebleeds, significant and unusual bruises. It's important to note that blood in the stools can either be black or red. It is somewhat rather rare that when the INR is in its target range that the causes of these symptoms are internal bleeding. You should therefore be alert to these symptoms in order to act quickly if they occur. You also want to make sure that the treatment plan provided to you is the best suited to your needs. Surgeries and dental care, in particular, should be done cautiously. It is important to inform all health professionals that you are taking Coumadin. This includes your pharmacist, surgeon, your family doctor, and your dentist. If you wish, you can wear a medic alert bracelet marked Coumadin. These bracelets are available in all pharmacies. On the other hand, if your INR target is under the expected range, your blood isn't anticoagulated enough to protect you from blood clotting. You may be at a greater risk of cerebrovascular accident, pulmonary embolism, or phlebitis. It is important to seek immediate medical attention if you experience signs of CVA, pulmonary embolism of phlebitis, such as severe headaches, chest pains, difficulty breathing, weakness, pain, or swelling in the legs. If you are a woman of childbearing age, make sure to use a method of contraception. Coumadin may cause fetal malformation. It is for this reason that it is imperative not to use Coumadin, and this from the beginning of pregnancy. If you wish to have a child, talk to your doctor so he can replace your Coumadin by another medication. If you become pregnant during your Coumadin treatment, immediately notify health professionals monitoring your INR. This concludes our global view on Coumadin's particularities and recommendations. If you have any questions, you may consult the pamphlet given to you. You may also consult your doctor, nurse, pharmacist, or your Coumadin clinic. For questions concerning the duration of your treatment, ask your treating physician. We hope these indications will make you feel more at ease towards your Coumadin therapy. Thank you for your attention.